Hi, I'm Jungwon. I'm one of the co-founders of Elicit, and today I'm going to experiment with using Elicit for health, economics, and outcomes research. So I'm by no means an HEOR expert. It's a domain I'm still learning about. So please share lots of feedback either on this video or on how you see Elicit being useful for this line of work. I'll put in different contact information in the description. You can email, leave comments, etc. I would definitely love to talk to more experts in the space and try to make Elicit increasingly useful for it. So my rudimentary understanding of HEOR work is that it's pretty cool. It seems pretty cool. It actually seems to have parallels in lots of other industries. But my understanding is that broadly the goal is to kind of do an impact assessment of different medical interventions and do kind of different ROI or like cost benefit analyses of different medical interventions. And so those interventions can be drugs, they can be treatments or procedures. And the goal is to help different stakeholders in the kind of within life sciences and in the biomedical space make decisions about drugs and their trade-offs. So help pharma companies prioritize different opportunities and establish pricing, work with the payers to do that, help policymakers think about budget allocation and funding. So it seems really cool. And I'm hoping that Elicit can really help make it easier to understand what the total impact of a drug is. It seems like some of the human components are. It also helps with really estimating the cost and burden of certain illnesses, both tangibly and intangibly. What is, the quality of life lost or the costs of having to deal with certain diseases and difficulties. So yeah, it seems really interesting. So I'm hoping Elicit can help with that type of work. All right, let's get started. So I think today I'm going to use the find papers workflow. You can actually do a lot of the same things with the extract workflow if you have a bunch of your own papers. I'm going to try, what's the frequency of biopsies and complications among lung cancer patients in the US. What is the frequency of biopsies and complications among lung cancer patients in the US? First, we're going to search over our database of public papers. We're going to find papers who are most relevant. This was actually the paper that I was looking for that inspired this query, so that's great. So a couple things. We're looking for, a few things. We're trying to kind of estimate the market for this drug or the total need for this drug. So we want to understand how many people are wrestling with these issues and in specific places like in the US. So I have a list of 8 papers here. I'll start with I can always load more. And first, I think I just kind of want to understand the basics of what these papers did. My impression is that there are different kind of qualities of studies, some of which are more compelling than others. But depending on the kind of issue that you're looking at, there may be more or less research. From the experts I've talked to, it seems like prospective studies are the best, then maybe retrospective studies, and then occasionally there are like very small case studies that maybe need to be considered more contextually or taken with a grain of salt. So to account for that, I kind of want to first make sure all these papers are in the US, because that's specifically the area that I'm looking for. I'm going to come over here and I'm going to add a region column. And this is going to tell me where the study took place. So that seems pretty straightforward. It seems like most of them are either in the US or it was not directly mentioned in the paper. Then the next thing I probably want to look at is the data set to see, how broadly, like what databases were used, and how broadly this research was done. So I'm going to add this predefined data set column. I get a bunch of results here. So it seems like some pretty large databases. Also just cool for, if you're relatively new to the space, learning what kind of data sets and resources are available for this type of work in general. But a range. So some have, this one has like 73,000 patients, 5,063. So a range of different data sets. But definitely looks like there's some pretty legit data sets in here. And then similarly, I think I want to maybe get a sense of like methodology. Just to get, so yeah, here it's like this is a retrospective study. This is also retrospective review. My guess is most of these are going to be retrospective. Cool. I think this is a good time. So those are just some predefined columns that we have defined here, which is really one of the most powerful and unique features of Elicit. We have a bunch of these predefined columns. There's like a long list here for all different types of domains. I think region, dataset, and methodology are good ones for this one. So I've confirmed that, these papers are talking about the country that I'm interested in. You could just as easily have asked about, place in Europe or Asia, somewhere else. The datasets seem like pretty legit. Again, I'm not an expert, but it seems like there are large numbers here and maybe official datasets. Methodology seems like they're mostly retrospective studies, a few that I might want to dig into more before I can be sure. So that's like kind of a good anchoring of like, okay, roughly it seems like these papers are the ones that I want to be looking at. And if that wasn't the case, I could always, pick a paper and delete it. I don't want to do that now because I want to keep this paper. Or, I can select papers that seem good and click show more like these and then guide Elicit to more relevant papers if not all of them were relevant to start. And like I said, you can always click load more to generate more papers, but it is a lot of information. So I usually like to start with 8. I think this is a good opportunity to show you the difference between this default QA and what we call high accuracy mode. So I'm actually going to come here, duplicate this column, and turn on high accuracy mode for one of them. High accuracy mode uses more advanced models, like more powerful models. They are also more expensive. So for a lot of kind of casual users, I think it will use too many credits to use high accuracy mode. But if you're, working for a pharma company or a hospital and you're doing, a formal research project where it's really important, you care much more about getting really accurate answers, high accuracy mode makes a lot of sense. It also has a few other benefits. It tends to be a little bit more structured. So you can see in this case, the answers are in bullets. You can, I might show you this later, but you can also edit the instructions. And generally, my experience is that it obeys instructions much, much better than the kind of default mode. And then if there are answers, if you're trying to get data from tables of papers, you need to turn on high accuracy mode to do that. So I think for this type of work, you will often want to incorporate any information from tables. So high accuracy mode probably generally makes sense. I pointed out this, I kind of briefly glossed over this instructions thing. For all of our predefined columns, you can go and see how we've defined this column, the description and any instructions we gave to the model. And so you can either edit those if you find that they're not relevant for your use case, or you can kind of use these as a starting point when you create your own columns as well. So you can see all these like default instructions. We've optimized these to perform well for our evaluations and testing, but obviously for your specific case, you might want to tweak it or look for some different information. Okay, great. Okay, so I think we have like reasonable papers with reasonable methodologies. Now I want to like actually get the data that is going to inform any of my cost benefit analyses. So next, I'm probably interested in how many people are studied in each of these retrospective and various studies. I'm going to add that. You can see if none of these predefined columns are exactly what I'm looking for, I can very easily type in my own column and create one that's specific to my use case. And like all the other columns, I can also edit them and provide more descriptions and instructions depending on the answers I get back. Often with things like this, I want to check the answers. I want to know if this is right or not. So with Elicit makes it really easy to check language model generations. It's a very important part of very important part of the product, and we really prioritize this a lot. So, everyone knows that language models are not always accurate. They hallucinate. And even people, honestly, we've seen even people like mess up a lot of these extractions, right? No one has perfect accuracy. So I think it's pretty important to make it easy to check the work. It's not going to be 100% right all the time. So yeah, let's see. If I click on any of these generations, I'll see relevant quotes here. So you can see the quotes we pulled from the paper. You can kind of tab through to see what is relevant. And it seems like here it's actually saying that the biopsies performed was 32,000, an average of 1.7 biopsies per patient. So my guess is that actually this number is wrong. and that there's fewer patients than there are biopsies. I'm going to check through a couple more. Let's see, click on this one. Oops. This one, total of 3,000 patients. The study population includes N of 22,870, so that one seems right. Let me look at this one. This one is mostly reporting on procedures again, so that also has a bit of a question mark. Could be the same or could not be. This one says 63 patients, so that seems promising. Again, you'll probably want to, depending on how you're going to use these numbers, you might want to go in quite a bit more detail, but you can see like pretty quickly, you can quickly get a sense of what is like likely to be correct and what might be obviously wrong. So this might be another good place to try and compare regular QA with high accuracy mode. Let's see if high accuracy mode gets this right. Okay, this is interesting. So this one says 19,302. Let me just do that math really quickly. 32,814. Yeah, so if I do 32,814 divided by 1.7, it is 19,302. So that was pretty cool. The high accuracy mode can correctly do math. But yeah, you can see in this, a lot of times that they will actually be pretty similar. The answers will be pretty similar. Like even the cheat mode is pretty good, but occasionally the high accuracy mode will get things right that the cheat QA, like the default columns won't. So yeah, I think if accuracy is pretty important to you, I would strongly recommend turning on high accuracy mode. Great, so now we have an estimate of the different number of people that are kind of getting all these different biopsies and having complications. So we can start to kind of estimate the total impact of any interventions that we might want to implement to reduce some of this work or some of these complications and side effects. Yeah, and then I think I can specifically ask maybe how many biopsies are there to see if there's different information. Yep, so this is able to distinguish between biopsies and patients. It's good to see all the numbers being consistent. This one looks like maybe 67 biopsies over 63 patients. Yep, that's good. 63 patients, 67 biopsies. Cool, great. So again, yeah, this is just the default. This isn't even high accuracy mode, but I think it's already doing pretty well on the data extractions. And then I probably also want to understand how many people suffered complications. You can see it's like super easy to just ask these questions, right? And then get all of this information across all these papers. You can see some of these like little error marks here. This is when when the models that we've trained are not confident. So it's a flag to indicate to you that you may want to double check or be a little bit more skeptical of this answer. Sometimes it'll come up after a particular number and then it'll say, oh, maybe this is not the right number. Maybe this number is referring to something else. Sometimes you'll see it next to like a not applicable, and then it's entirely possible that maybe it is mentioned, but in like a more opaque way, or the model just got a little confused. So again, if you want to be really accurate and careful, you can double check these, and this is kind of how we help you prioritize your time reviewing all the different language model generations. The other thing I should mention is in general, so if the paper is an open source paper, we will be able to use the full text of the paper. You can see that we have for this one, like the full text of the paper here. But if it's not, we will only be able to use information from the abstract. So that's really important to keep in mind. The paper might have this information and it might just not be in the abstract. So like maybe that's like really important context for all these not mentions. And yeah, any information that's not going to be in the abstract is going to be hard for us to extract if that's all we have access to. This is a good place where you can use the other workflow that I mentioned in the beginning called extract data from PDFs. So if you have access to those papers, then you can upload those papers and then we can operate over the full text of those papers. Just to be clear, because people get confused sometimes, that doesn't mean Elicit can only find open access papers. Elicit can find all different types of papers, but we can only use the full text to fill out these columns if the paper is open access, because if it's not open access, we don't have access to the full text. So I hope that distinction is clear, because I think people sometimes get confused about where they can see the full text or not. Okay, so how many people suffer complications? a bunch of information here. You can always, again, click in and see the relevant pulmonary complication rate of 13%. And yeah, you can also always open the paper and see in context where this information is. You know, some of these, like even some of these abstracts are pretty long. So even just having anchors to relevant parts of the abstract, I think can be pretty helpful, even if we don't have the full text. And a lot of the abstracts do have really rich information and most of what you need to know. I mean, those abstracts are going to be much better summaries of the paper than really any AI generated summary. Let's see if there's anything else that I wanted to look at. Maybe what were the types of biopsies? It seems like they're different. Okay, cool. Different types of biopsies. Bronchoscopy and percutaneous. Perch accounted for 95% of all procedures. Here's a more detailed breakdown. Different types of biopsies. Maybe like what do I think cost is an important component. I'm not sure if this will be mentioned in the papers. Oh, cool. This is not medical cost. Most of them don't seem to mention costs, obviously. There's some costs here, which is super helpful. Patient surgical biopsies. Okay, great. So often when I get results with the default column where there's a lot of not mentioned, this is usually when I turn on high accuracy mode just to check, because sometimes high accuracy mode is better at picking up that information. And especially if there are like lots of little kind of unconfident flags, uncertainty flags. As I was kind of prepping for this video and I was like going through all these questions, afterwards I was like, wondering is there anything else interesting about this paper? Just because it seems like there's a lot of information. And at this point I feel like I do have bits and pieces of what they did, but maybe not the overall, like what is the goal of this paper? So I can even ask questions like that, like anything else interesting? There's a bunch of information here about kind of what they did. I think this is actually pretty similar to one of our predefined columns, main findings. It's a little bit different. But yeah, so you can kind of get a mix of very detailed, extracted information, quantitative information from all the papers, as well as some like more exploratory, open-ended questions and higher level summaries of what the study was about. I think the other thing actually I wanted to show before wrapping up was we talked about methodology, and we talked about the different types of studies. So let's say you actually want to, you're really excited about these questions and you want to find all the studies that are relevant. Right now we looked at 8. It's already a lot of information, but maybe you want to look at like 100 or 50. One thing you might want to do is, maybe I will edit this. Okay, actually maybe I'll edit this one. I think I'm going to create a new column called study type. And then I'm going to use this column for some filtering. So I'll give it specific instructions like classify the methodology as one of prospective, retrospective, case study, I don't know, other, unknown. So now I want to take this kind of open-ended methodological description with a lot of rich information and structure that so I can do some filtering. So I'll create this column. Retrospective, and maybe case study. And then from here, I can click on this button, which is filter. And then I can filter for columns where there's retrospective explicitly mentioned. So I guess I filtered out that case study one. So you can do that. And then, we don't have any prospective studies here, but if we did, oh, maybe we do. Okay, cool. Yeah, I'm not sure. I would want to double check that this one's actually a prospective study. But certainly, well, yeah, that's if it is, then it correctly filters for it. You might want to turn on high accuracy mode to double check that. You can see how the filtering works, so you can kind of narrow down different studies based on the criteria that you're interested in. It's the keywords are basically like additive, so it's all papers that mention any of these keywords. So you can, if you want to include a larger group of papers, you can add multiple keywords to have papers that match at least one of those keywords. I think that's everything that I wanted to show you today. So in summary, if you're doing health economics and outcomes research, and the data that you're looking for is often covered in academic papers or studies. You can use Elicit to do that. If you haven't found the studies yet, you can do the find papers workflow to search through a database of over 100 million papers. And you can kind of systematically go through and extract information across all of those studies, the data that you need, both really detailed and extractive quantitative information, as well as more open-ended and narrative qualitative information. We have a long list of predefined columns that you can use that are kind of immediately relevant for this, and then it's super easy to create your own column and extract information that's very specific to your research query. If you do, and then I think we talked about when high accuracy mode makes sense. So you can, if you want to get data from tables, if you care more about accuracy and are less sensitive to cost, you can turn on high accuracy mode to get the best answers. You can double check places where we're not confident. You can click on answers to see where in the paper information is coming from. You can filter columns. You can kind of create columns that break things down and categorize papers basically, and then filter by certain categories. If you're an Elicit Plus subscriber, both high accuracy mode requires being an Elicit Plus subscriber, and then you can also export if you're an Elicit Plus subscriber as well. So if you want more flexibility to work through these results, you can download it as a CSV and then fit it into whatever other models you have there, or kind of edit the results more directly. And then you can do the exact same thing if you extract data from PDFs. Just upload the papers that you're interested in here, and you'll have the same exact columns that you can extract there. So if there are any papers that we don't have access to, or any full text that we don't have access to that you want to use, you can upload them directly into Elicit and do the same thing. All right, let me know, health economics and outcomes researchers, what you think about this, and if you have any feedback, anything else we can do to make it more useful, that'd be great. Thank you. Bye.